Hello, I'm Dr. Franklin.
And I am Dr. Coates.
We are Stethoscope Diaries, Sisters in Scrubs.
Yes.
We are here to be giving you some good information today.
Yes. This is an episode that I think is really important about pregnancy-induced hypertension. Another term for that is hypertension disorders in pregnancy. And a lot of women are affected by hypertension or hypertensive disease in pregnancy. So I think this is one that we really should discuss so that a lot of our viewers can understand what's important when they're diagnosed, things to look out for, especially a lot of first-time moms.
Absolutely. And it doesn't just happen in first-time moms. It can happen in a person that's been pregnant multiple times before. So everyone needs to know what the signs and symptoms are.
I think the best way for us to start is to talk about some of the risk factors. So what women are at risk for hypertensive disorders in pregnancy based off of their medical history.
Sure, absolutely.
So one of the first ones is first-time moms in general. So any woman who gets pregnant for the first time, you are at risk for having hypertensive disease in pregnancy.
Yep. Part of that reason, too, is because you don't have a history to base it on. You don't know what complications you might develop in pregnancy.
Absolutely. Other women who may be at risk for hypertensive disorders in pregnancy who are at risk are women who have known chronic hypertensive disease.
That's right.
As well as women who have other medical problems such as diabetes prior to pregnancy.
Yes. So now we talked about pregnancy-induced hypertension. You had a good point about chronic hypertension. Yes. That is when you have high blood pressures before pregnancy even comes about.
Correct.
And you may have that diagnosis if you've had to take blood pressure medicine in the past. If a doctor in the past has ever told you that you have had high blood pressures at office visits. And so even if your blood pressure is normal now, if you've had that diagnosis before, you've always got it.
Yeah. I think a lot of women get confused about that, especially a lot of the moms that I see for their prenatal visits. They're like, well, I'm not on medicine right now. And I'm like, but that is still a condition that you will always have. We have to bring that to attention at your prenatal care visits because us as your providers, we're going to have different recommendations for you based off of that history.
Definitely. So one of the reasons, too, that a lot of people might be having high blood pressure before and now it's better, weight loss.
Yes.
Tons of people are using weight loss medications. They're exercising, dieting. And so now that they've lost some weight, their blood pressures have normalized. But that did not take away the damage that would have been done during the years that you had it.
I agree.
Now, there are so many risk factors that put people at risk of hypertensive disease in pregnancy. In our group of people that are now getting pregnant, the data shows that the majority of people are getting pregnant in their 30s.
Yes.
And so in their 30s, fertility is less than when you're in your 20s.
Yes.
So people are pursuing lots of things, education, all those things, job, work. And so now some people are having issues getting pregnant. So they need some assistance.
Of course. Yep.
So people that have to undergo in vitro fertilization or any kind of reproductive therapies to get pregnant, those people are at risk. When you do IVF or other supportive factors to get pregnant, you may have twins or you may end up with triplets.
Yes.
That certainly increases your risk. And then, like I said, those people are typically in their 30s that have to undergo those treatments. They are considered advanced maternal age at the age of 35 and over.
Yes, I agree. So those are definitely some major risks. Other things that I always remind women about is any preconditions prior to pregnancy. We call those comorbidities that may exist. So those are diagnoses such as history of prior kidney disease that may be present, any history of obesity or any obesity being diagnosed at your prenatal care visit. Other things is autoimmune conditions such as lupus. Lupus is one of the most common autoimmune conditions that also increases your risk of having hypertensive disease in pregnancy. And that is why bringing your history to the appointment with your doctor. That's why we ask those questions. That's why it's important, so that we can counsel you. And then we're going to watch those pregnancies a little bit closer.
Absolutely. One way to reassure people, I would say, look, you are high risk. You've got a high risk condition, but that just means we get to have more visits.
Of course.
We get to spend more time together.
More ultrasounds.
More ultrasounds.
They love when I say that.
Yes. But that is all a part of
course.
keeping a person healthy and keeping their baby healthy. So at the end, they're going home together after their stay in the hospital.
I agree. Yes. One of the things that I do get and I absolutely love is when women come to me who have a known diagnosis of chronic hypertension, which, as we described earlier, is hypertensive disease that was diagnosed prior to pregnancy. When they come to me, whether that's at an annual care visit, a problem visit, we also call these preconception visits, and they come to me and say, hey, I have this known diagnosis. I have this known medical disorder. What are the things that I can do now prior to getting pregnant? If you have a known medical disorder, the things that we listed out, that is the best piece of advice we can give you. I don't feel like I do enough preconception visits, and we could do more.
That's true.
Yes.
But a lot of people don't come in before they get pregnant.
Yes.
So whenever someone does come in to see me and they're like, I'm thinking about getting pregnant, I just give them a round of applause because I'm just so excited. People are thinking forward. People are planning. And the majority of time when we are providing prenatal care to a patient, it is after they've gotten pregnant.
Yes.
After they may have been planning on their own with their partner to get pregnant and have a baby. But there's so many things that you can miss out on to make sure you can get your health where it needs to be. You can get on vitamins many months beforehand.
Absolutely, yes. Yes. I think that just having the conversation initially, it doesn't have to be a preconception visit, which is what we call it.
That's true.
But just having that conversation when you see your doctor, it brings up more educational opportunities for you so that we can talk about things that you could be doing right now. And one of the biggest things is monitoring your blood pressure at home, knowing what the normal and abnormal is. And then other thing is seeing if you have any signs of other organs being damaged. Because if you have a known hypertensive disease prior to pregnancy, we want to make sure that it hasn't affected other organs. That can include your kidneys, that can include your eyes, things like that, because we want to make sure you're at your healthiest state prior to proceeding with pregnancy.
Absolutely. And that goes into having a primary care physician or at least coming to get your regular routine annual exams with your OBGYN. So many people are very healthy otherwise, and they really don't have a primary care physician besides their OBGYN. So when you see us annually, we're checking your blood pressures, we're looking at your weight, we're looking at what your weight was the year before, and kind of watching the trends of your blood pressure. So we are looking for all those things that your primary care or family medicine doctor would normally look for.
Yeah.
Hey guys, if you like what you're hearing and you like what you're seeing, hit that subscribe, hit that like so we can bring you more content. Now let's get back to this episode.
One of the best things women can have is a blood pressure cuff monitor. And I have to acknowledge the fact that not all women can afford one. One of the good things you could do is always talk to your providers, whether that's your OBGYN, your primary care provider. Even some health departments have resources. There are a lot of community programs, depending on what community you live in, that may have resources that provides blood pressure cuff. A lot of people ask me what's the best cuff. And I tell them the one that goes on your upper arm or your brachial cuff is the best. But if you have a blood pressure cuff, something to monitor your blood pressure, that is all that matters to us.
Absolutely. And I will say that you have a family member
that
has high blood pressure that you can borrow their blood pressure cuff.
Everybody has one.
Does your mom have one?
Right.
So somebody in your family has one that you can go and visit periodically, take your blood pressure, grocery stores, the pharmacy may have a blood pressure cuff.
Yeah.
So you have some other alternatives.
I agree. And then also bringing it to the appointment with you.
Definitely.
Because we love to check what your blood pressure cuff at home is reading versus what it's reading in the office with us where you're getting it checked by a medical professional.
Absolutely.
So always bring to your first appointment, bring it to any appointments, especially if you start to notice a trend in your blood pressures as if they're like starting to elevate. And we haven't even talked about what that number is of elevation.
Okay, that's right. So in pregnancy, at least, we know it's different from the high and abnormal that is in the non-pregnant person.
Correct.
Now. The American Heart Association changed that.
Yes.
So the numbers are quite different.
So we have two numbers that we are always looking at when we're checking your blood pressure. We have the systolic blood pressure. That is the blood pressure when your heart is working. And the diastolic blood pressure. That is the blood pressure when your heart is at rest. So there's two numbers. If the number is 140 or more on the top number, that's abnormal. And if the number is 90 or more on the bottom number, that's abnormal. Those are the biggest numbers that I think you should remember. 140 over 90, either of those numbers being elevated, that's an abnormal blood pressure, and you need to be talking to your primary care doctor.
Absolutely. And just because your blood pressure goes up that high does not mean you need to be on medication.
Correct.
Right?
Correct.
So if you have high blood pressure before pregnancy even started and you are on a blood pressure medicine and you have the desire to get pregnant or plan pregnancy soon, you need to be talking with your OBGYN. You need to be talking with your primary care doctor, your family medicine doctor, anyone that can adjust you and move you to a medicine that would be safe for pregnancy, because not all of them are safe in pregnancy.
That is true. We sometimes have to change blood pressure medicines so that you are on the correct type in order to have them for the prolonged pregnancy. And sometimes we even have to drop that blood pressure medicine.
Absolutely. And so we're talking about blood pressure medicine for people that have pre-existing blood pressure disease before pregnancy.
Correct.
But when pregnancy-induced hypertension comes into play, like gestational hypertension or preeclampsia that is directly related to pregnancy, usually after the 20th week of pregnancy, we typically aren't giving medications to mask those symptoms, because when those symptoms worsen, when that disease worsens, that is a sign that probably delivery needs to happen.
Yes. This is important because it's not only risk for mom, but it's also risk for the growing baby or the fetus.
Right.
Some of mom's risks, if we don't have controlled blood pressure in pregnancy, includes things such as stroke, seizures, as well as having blood clots that can form throughout your body. And it also could put you at higher risk for a C-section if we have to emergently act in order to save you and your baby's life.
Absolutely. And don't forget about the baby. The baby is our other patient.
Yes.
So we have to walk that fine line between keeping mom safe, keeping baby healthy and safe, and trying to get more time in utero so they can have better brain development, their lungs can mature, but they have a risk of preterm birth.
They do.
That is the primary outcome of people with high blood pressure and pregnancy is going to be preterm delivery. Yeah. You do not want your baby in the NICU. No. So there is so much work that we need you to do, so much work that has to be done to prevent that. Yes. The other risk factor we see is growth restriction. So these babies are not getting the oxygenation, the support that they need, and so they're not growing as well. Right. So usually these ladies, they will get routine ultrasounds to measure the growth, to measure the fluid around the fetus.
And fetal growth restriction can also lead to your fetus or your baby staying into the NICU longer than what's expected. So that's why this is truly important, not only for mom, but also for that growing fetus, for that growing baby.
Absolutely.
When I was pregnant, I actually was diagnosed with gestational hypertension. And that was many years ago. And there wasn't anything that we could do during the pregnancy to help with reducing risk for eclampsia or seizures that are related to high blood pressure. That's not the case now.
I know. Thank goodness we've got something that we can advise you to take.
Yes, and it's really simple. You can get it from probably grandmas, aunts, parents. It's baby aspirin.
Yes.
And people are like, what? I'm like, yes, baby aspirin. There was a study that was done that showed that baby aspirin reduced the risk of having severe hypertensive disease in pregnancy, like preeclampsia, which is the seizure disorder associated with high blood pressure.
Right. So the baby aspirin, 81 milligrams.
81 milligrams. Yep. Over the counter. You don't need a prescription, but we can send in a prescription if that's what will help you take your medication. And so you start that as early as 12 weeks and you continue it throughout the duration of the pregnancy.
Absolutely. So there are some signs or symptoms that you can also look for.
Yes.
So, of course, you will want that blood pressure cuff at home or at grandma's house. You go visit grandma more often.
Right.
But you can check those blood pressures and make sure that they are in the normal range. You know, less than 140 on the top number, the systolic, and less than 90 on the bottom number.
Yeah. A lot of my patients ask me how often. And I tell people at least 3 times a week. Or if you're having symptoms, which I know you're about to get into, but I say at least 3 times a week, checking your blood pressure so you can kind of know where your normal range is.
Absolutely. Some people that I'm really worried about, I have them check it every day.
Yes.
That may have already have a diagnosis.
Absolutely.
That they have gestational hypertension, they have preeclampsia, and we're watching and waiting until that switch flips.
Right.
And it is time to have the baby.
Yes. And that can happen in a short amount of time. That can happen within 4 hours. That can happen within 2 weeks.
Absolutely.
It can truly be something that is very quick. And that is why we can change the management plan in that short amount of time.
Absolutely. So we talked about checking your blood pressure on some kind of routine.
Yes.
Now, we talked about also checking your blood pressure if you're not feeling well.
Yes.
So some of the signs that you should be looking for are going to be right upper quadrant pain. That's right here where your liver is. The liver capsule starts to swell and stretch, and then it causes discomfort.
You will have pain there. Yeah.
Other things, headache, blurry vision, and just overall not feeling well.
Spots in your vision is another one. Some women may even have floaters in their vision. Other things that I tell people, if you're having chest pain, changing your shortness of breath, because you're going to be short of breath because you're pregnant.
That's right.
But if you notice a change, if you're gasping for air, things like that, then that is different. Swelling. Now, swelling in pregnancy can be normal, but I often tell patients if you notice that swelling doesn't get better when you elevate your legs, so you're lifting them up with a pillow or something under it, or if you pressing your legs and a dent is left in that leg, that can be a sign that you have a lot of fluid in your body, and that can be associated with hypertensive disease and pregnancy as well.
It sure can. So some of the things that we do once you have that diagnosis of high blood pressure in pregnancy, we really have to decide whether or not it's gestational hypertension or if it's preeclampsia. They are different. They both have high blood pressures in pregnancy. One, you're spilling protein out through your urine, and the other one, you're not. And treatment is a little different.
It is.
Like delivery is still the way to get past this disease and have the pregnancy over with so that your body can start recovering and get back to the baseline. But you might have to get a medicine, and this is an IV drip called magnesium sulfate if you are diagnosed with preeclampsia because you are spilling protein in your urine.
Yes. And that medication is strictly to prevent you from having seizures. That's why it's important.
That's right. It is not always to lower the blood pressure. It's not a blood pressure medication, but you are going to be on bed rest, so that helps your blood pressure. It does cause dilation of the vessels, but its primary job is to prevent a seizure, which we know is the natural course of preeclampsia if you do not treat it.
Absolutely. Sis, you did mention IV magnesium sulfate is a medication that we would give for women who have preeclampsia or high blood pressure prior to seizures to prevent them from having seizures. And I think that's important because sometimes we get a little pushback from women about why we recommend that medication. And that's the only medication that we have that can reduce seizure disorder in pregnancy. Another thing that I get from my patients, I don't know if you get this a lot, is just because I have preeclampsia or just because I have gestational hypertension, this means that I have to have a C-section. And that's not always the case.
No, not
right?
at all.
Yeah, it's a case-by-case basis. Because you have these disorders, we do sometimes recommend delivery just depending on how far along you are or how bad your disease is affecting your body if you are needing to be delivered right then. And so that helps us decide, are you healthy enough at that time for us to proceed with an induction where you have a vaginal delivery? Or are you not healthy enough? Or you're not stable enough to where we need to deliver as fast as we possible to save you, your life, and your baby's life?
Absolutely. And so when we talk about delivery and the labor process, things can change.
Yes.
So you may be going down the path of having a vaginal delivery, but your blood pressure gets worse.
Yes.
Your labs start to become abnormal, and you could start developing a condition called HELP syndrome, which can be dangerous, and it can lead you to hemorrhaging and bleeding.
Yes.
So maybe also a C-section is really not our first step that we want to do, because it could impact whether or not you can clot at your incision and that you're not going to bleed.
Yeah. So we make those decisions truly based off of the state of you and your fetus at that time, because there can also be monitor changes of your baby's heart tones, and that can help us determine how affected is your fetus at that time due to your blood pressure changes. So we're looking at a big picture, not only laboratory values, your respiratory status, your fetus heart tone status. We're using all of that to help us make a decision.
Right. So now you're delivered.
Yes.
Your baby is delivered, whether it be by cesarean or by vaginal delivery, as long as everyone's safe. That is the ultimate goal.
Yes.
Now you are going to be on the postpartum unit. We're still going to be watching you closely. We're still going to be doing exams on you, getting blood work, looking for signs of preeclampsia, because preeclampsia doesn't just go away as soon as you deliver your baby.
Exactly. Some women can get preeclampsia up to 8 weeks postpartum. And so that is why it's important to still check your blood pressures at home, still follow up with your primary OB physician. So often I see my patients back within 3 to 7 days after a delivery, because I want to make sure their blood pressure is still within the goals that we have set.
Absolutely. So all of the recommendations that were there before you gave birth exist after. You're still going to be checking your blood pressure on a routine basis. You're going to be looking for those signs: headache, blurry vision, pain here at your liver. You're going to have to borrow that blood pressure cuff from grandma or go visit grandma.
You're going to owe grandma something for her
I
blood
know,
pressure
poor
cuff.
grandma. We don't want grandma to have a stroke
Right.
because we done stole her stuff.
Absolutely.
But those still apply. And so really, your blood pressures are not expected to go back to baseline until really 12 weeks out postpartum.
That is true.
So if your blood pressures are not improved at that 12-week mark, you probably had chronic hypertension present before you got pregnant, and you did not have that diagnosed ahead of time.
I think this is also important is because you may not go to labor and delivery after you deliver. You may be in an urgent care center. You may be in an emergency room. So it is important for you to still tell the providers that you're talking to when you deliver. Because if you're not talking to an OB doctor, they may not still be thinking about preeclampsia because you delivered a month ago, you delivered 2 months ago. You have to be your own advocate in that situation, because that is where women can get hurt.
And one of the things that I tell my patients is that I depend on you.
Yes.
You know your body. You've got to listen to your body. You've got to hear those subtle signs that tell you, I don't feel well. I need to check my blood pressure, or I need to come back to the hospital. So as much of it as is a responsibility of us as your provider, it's definitely our partner who is the person pregnant to really pay attention to those things, play a major role in the care that they're receiving, and contributing to having that healthy pregnancy, and calling us and notifying us and coming into the hospital when they need to be seen.
Yes.
Well, we hope you liked the content that we brought today. Hypertensive disease in pregnancy is so important. We hope you learned something.
Yes.
We hope you can arm yourself with this information to protect yourself and your family.
Yes. We'll see y'all next time.
Bye.
Bye.